you. Okay, so we have gotten to move around a little bit. We feel a little better. The auditorium or the theater feels so much cooler now than it did when we left. Everything's perception, right? I need to ask if Brenda, and I'm going to kill this last name, Muniv is in the audience. Brenda?
Come on down.
No. Hi, Brenda. Are you out of uniform?
No, well, I do that. Thank you.
You're welcome. See, I got her all worried she's going to have to speak. Okay, we're going to start. Good job. We're going to start our afternoon session with one speaker and then the employment panel. So we're going to change the order a little bit. After Michael speaks, he's going to join the HR panel, and we're going to hear a little more about things like novice nurse programs. What does it mean? I know I got well into my third semester before I ever understood everything. So we're hoping to give you a little. It's still information that will be helpful to know. So we've been able to have both Wellington Regional Medical Center represented as well as Delray Medical. So we're going to start our afternoon session with one speaker, the panels, and then we'll have a question and answer session. Please have your question and answers ready. Y'all did so good in the morning session. And then the really boring part of the day, we're going to give away some baskets, okay?
Okay, welcome back, everyone. Our next speaker is named Michael Heath. Michael is a graduate of the Palm Beach State RN program. He graduated back in spring 2014. Give him a round of applause. Michael currently works in labor and delivery at St. Mary's Medical Center, and this is an excellent example of diversity in nursing. A male working in L&D is not common, but without further ado, please help me welcome Michael Heath.
All right, thank you guys for inviting me here today. I apologize in advance, I'm extremely nervous. When I introduce myself, it's only a 1-to-1 patient ratio, so bear with me. But I do want to say thank you for inviting me here to speak at Palm Beach State's NSA Day. Some of you know me, and some of you don't. But I'm a former student at Palm Beach State, and a year ago, I was sitting where you guys were, and today, I'm an RN. All right? What does an RN stand for? Right now, it stands for real nervous. Okay? Generally, and after you pass the NCLEX, it's going to stand for a registered nurse. All right? And once you guys get there, it's going to be in a year, 6 months. You guys need to give yourself a pat on the back. It took me 265 questions in 6 hours. And yes, I had hair before then. Okay, so what is a nurse? The public image of a nurse continues to be a white woman in a white dress and a white cap. The news, advertising, and entertainment industries commonly portray feminine traits associated with nursing, and it often has an effect on turning off men from the field. In a survey, male nurse respondents indicated that they were influenced by this misconception that the profession was not appropriate for men. One prime example comes from the popular Meet the Parents movie trilogy, where Greg Fokker, a male nurse character, fends off suggestions that he is an unfit man to marry because of his career choice. So what is nursing? According to the American Nurses Association, nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and the advocacy and care of individuals, families, communities, and populations. I think that's very textbook appropriate and politically correct and all, but I think it misses the point. Nursing is all about caring. But not just about caring, it's competent, compassionate caring through evidence-based practices to promote the greatest possible outcomes for those we look over. With that being said, it's inconsequential in most cases the fact that I am a male and working in obstetrics, and we're going to examine that shortly. But first, I want to share with you a story by Erin L. Holland. Erin L. Holland is a perinatal nurse, and she discovered that during this survey and she found some hidden biases and it brought it to light. Upon reflection, she observed that a male nurse may have a positive impact on fathers in obstetrics. And speaking of fathers, she shares, if fathers could see that I can be supportive of a woman in this situation and still be masculine, then maybe fathers will participate more in the labor process. She starts off by stating, if we as women want equality in the workplace, why are we sabotaging our fellow nurses? Why do we call males in the nursing profession male nurses? Using this phrase insinuates that nursing is a female profession. And it is true that in recent history, nursing has been dominated by females. But according to 2010 statistics, 10% of nurses are male, and that number is growing. She states also that women have fought for status among male physician colleagues. We wanted to be represented for our knowledge, our training, and experience. And now gender stereotypes in practicing medicine have been torn to bits. We do not refer to women MDs as female doctors, yet we cling to our gender biases in the nursing field. So men are cautioned to be respectful of a mother's wishes and when they want to be cared for only by women. And this warning is appropriate and justified as some cultures and religions forbid men for caring for women. And other women have experienced sexual violence or simply prefer only women caregivers. But outside of these exceptions, it should be presumed that the gender of the nurse does not matter. And there's also a hypocritical bias against men in labor and delivery. And a lot of times it's especially apparent during nursing school. Thankfully, the staff here did not show me that bias, and they gave me a chance at my dreams. And it is common for a male student to be shooed out of a patient's room that not only has been to a male doctor, but has male residents rounding on her. The message that we give out to our fellow nurses is clear. Male doctors are respectful and take care of the patients appropriately, but a male labor nurse, for the lack of a clinical term, is creepy. I've also heard the argument that men don't understand what women need in labor because I can't have a baby. This is belittling and a backwards notion. If that concept was extrapolated out to other fields of nursing, then only cancer survivors can care for oncology patients. The mentally ill can work in psych, and only diabetics can teach about diabetes. And there are many women that have never and will never have babies that make fantastic labor and delivery nurses. And this is where my story starts. So I work at St. Mary's Medical Center in all 5 areas of obstetrics. Triage, which is a pregnant ER, antepartum, labor delivery, operating room, and postpartum. But let's take a step back to my first interview. St. Mary's held a job fair for OB nurses and had interviews on the spot. I found out about this job fair 3 hours before it started, and I hadn't even had time to start doing my hair. I called my nursing friends that I knew were interested and had already passed the NCLEX, and we all showed up together. And when I went to register for the job fair, I was the only guy. And I was one of the very few that was dressed up appropriately for the job. I knew that I had to stand out for this interview. I had to show them that I was very, very serious about this position. So when the interview starts, we get to talking, and I slowly pull out A1's published statement about allowing men to work in obstetrics. And I asked the question, well, does St. Mary's hire male nurses in your OB department? And our very own Pat Holland, which some of you know, was the one that interviewed me. And she replied, of course, that would be discrimination if we did not consider men in obstetrics. However, you would be the first. So I went home. I knew I didn't get the job. I ate a whole tub of ice cream. and I went to bed. But lo and behold, I got a call for a second interview. And right at the start of the interview, I told them, there's an elephant in the room, I'm a male, and I'm interested in OB. But I really hope it's looked upon blindly. Any patient that I cannot care for on these floors, I can also not care for on the medical surgical floor. And my supervisor agreed. She had a male OB instructor in nursing school, and she had two male OB nurses at her first job in another state. The patients, after a while, would actually request to have them as their nurse because their friends had such a great experience with them. And it was at that point that I knew I had a home. So as I started working, I realized the first thing I had to do was I had to win over a few of the staff that had never worked with a male nurse before. I knew that if I didn't have the support of my colleagues, that I would never be able to gain the support of my patients, because after all, nursing is a team job. So throughout the 6 months that I've worked at St. Mary's, I've had 2 patients that I could not care for, and one was my choice. And when I was told that they would prefer not to have a male nurse, I just simply replied, thank you for voicing your opinion, and I'll get another nurse assigned to your room. And that's it. It's not something that I can take personally, and it is something that's also happened on the other floors that I visited during nursing school. But let's move on to where I make a big difference at my job. At first sight, patients ask me if I'm their doctor. It's okay, I get this a lot. But I know I want to make a big impact, so I look past it. One of my first patients was a prima gravida mother. It's her first time being pregnant. We stayed at her bedside and with her husband during the labor process, explaining the drugs that she's receiving and what to expect if everything goes as planned. After pushing for just under 2 hours, the baby's head is finally visible, and he's starting to crown. I told the father that this is your wife and baby. You're going to hold her leg up with me, and you're going to hold her hand, and you're going to tell her that you're here for her. And now, emotions are running high for everyone in the room, especially the dad, because he's now incorporated into his first child's birth. As the baby is pushed out, and we have a flawless, beautiful birthing, and everyone is watery eyes, we hand the baby to the mother and ask the father if he would like to cut the cord. He says he isn't able to because he's so happy that he's crying so hard. Nurses, we don't listen. Understanding, we guide his hand with the scissors, and so he's able to take the first step in caring for his newborn son and his wife. And as the mom is doing skin-to-skin and breastfeeding, I educate the father with my nursing knowledge deficit care plan. That he too can bond with his child. When his wife needs to take a break, he too can also do skin-to-skin. So after 2 hours of stabilizing both the mother and the baby, I realize that I get to witness something beautiful, a miracle, every day at work. I get to help bring in life into this world at a very scary and uncertain time for families, and I can't believe to this day that I get paid for it. However, not all of obstetrics is butterfly and rainbows, especially at St. Mary's. We're a high-risk RIPIC center and level 1 trauma center. So it's just another day at work, and I'm a circulating nurse in the obstetrics operating room. I receive a report on a patient whose child is known to have severe internal abnormalities that are not compatible with long-term life outside the uterus. I thankfully have great staff working beside me that got our director involved and allowed me to become a one-on-one patient ratio to take care of this mother through PACU and the majority of her stay at St. Mary's. Her son ended up living for 6 days, 3 of which were spent with us in the NICU. Throughout these days, we cried together, educated each other, had all the family involved in the care of the soon-to-be lost. I grabbed a memory box for the mother, and we went over how to keep a thought journal about saving a lock of hair from her child, and had Now I Lay Me Down to Sleep take pictures with mom, dad, and their son. The hospital organized hospice care at home for their son, and we arranged an ambulance transport as we prepared their family. I realized I no longer see myself as a male nurse. I am a patient care advocate, a friend, a co-listener, and a nurse. So when I'm asked how it is to be a male in a female-dominated workforce and working in OB, I reply, I'm deeply humbled and blessed to be given this opportunity. Through good and bad outcomes, I learned what it truly means to be a modern-day patient educator, health promoter, counselor, medication passer, critical decision maker, and patient care advocate. So when I wake up way too early at 5 a.m. and I have a smile on my face as I'm driving to work, and I learn what patients I have for the day, they may not know my history, they may not know their story, but what they do know is that I am their nurse. Thank you.